Is this COVID-19 thing really a big deal? Um, by now, you've likely encountered a wide range of attitudes and opinions and spins on this pandemic. Just this morning, I heard that it was a hoax from China to disrupt the US economy, that it was a manipulated event to increase immunizations and to improve pharmaceutical company profits. There's a lot of, it's a hoax from political motivations. So we're not here to unpack or discuss the rumors or the attitudes or the opinions about this. We're here to talk about this pathogen and information about the pandemic so that we can be skillful in our practice. Hopefully, your training in science allows you to set aside theories, beliefs, and attitudes about this pandemic and allows us to focus instead on the aims of this course. We're going to learn about the newly discovered pathogen, and we're going to learn how to integrate research as it becomes available. We're going to learn how to practice with transmission-specific precautions so that we can do our best to keep our clients safe and to prevent the spread of COVID-19. Coronavirus is also known as SARS-CoV-2, as it represents the second iteration of a SARS-like coronavirus. We also are going to refer to this as COVID-19, and that's throughout the course you'll hear that that's how we're going to simplify the discussion. And COVID-19 is a viral pathogen. It's a novel virus, and we're going to talk about what that means. And it's impacted hundreds of thousands of people worldwide. As I've been working on this course over the last 10 days, putting very long days into compiling this information for you, it's been really challenging to stay on top of the latest numbers. And we'll talk about how we will, after this course, provide you some resources so that you can stay up to date. Just yesterday, it was identified as a pandemic, a global pandemic, and certainly I think that those of us that work in this field supporting families will want to know what that means for us in our communities and in our healthcare systems. So COVID-19 has certain characteristics that are leading to its rapid spread, and our evolving understanding of its morbidity and mortality are inviting concern. Yes, of course, flu-like respiratory illnesses happen around the world all the time, and indeed, people can die from influenza. But we're going to talk about some of the things that are unique about this particular novel virus and why it's eliciting the concern that it is. Perhaps our universal understanding is that this COVID-19 pandemic is affecting our lives. And I think we all can agree at this point that that is a true statement. And in our course, we want to figure out how to wisely be in relationship to our clients' questions and concerns, how to provide accurate information, and to be a responsible practitioner. So, I am not an infectious disease specialist. I'm a board-certified lactation consultant. I have a background as a midwife. I was trained in a public health setting, but I'm also not a public health specialist, and I'm not representing that sphere. But I have operated a practice for the last 23 years that provides board-certified lactation consultants in home settings and also in clinic settings. We have labor support and postpartum doula care. We've had perinatal education in our spaces for all this time, and I needed to create this kind of preparation for my own teams at Birthways. And so we made a decision that we wanted to share that with the greater community. I'm also the founder of Wisdom Way Institute, and at Wisdom Way Institute, I'm involved in creating practices and learning environments where health professionals can learn about mindful caregiving. And I teach trauma-informed care, equity, relationship-centered approaches. And I believe that we can transform healthcare by being transformed ourselves. And I guess in a nutshell, what I mean by that is that by learning to pay attention to our own habits and conditioning, our own reactivity, our own ways of relating to one another, we can begin to make more skillful choices. And by so doing, create more safety, equity, respect, and compassion in healthcare. I believe that we're strengthening the compassion muscle in doing some of the practices that we teach at Wisdom Way Institute. And so some of that is going to make its way into this course. But the other sort of related quality of why I'm offering this program through Wisdom Way Institute is that we are, I believe, the profession of lactation consultants, doulas, perinatal educators, I think we're all an underappreciated resource in creating really great outcomes for parents and their newborns. And particularly at times when healthcare systems may be taxed, I want us to put our best foot forward in doing what we do best, which is caring for families in a way that stacks their odds for effective lactation establishment, for low-risk births and low interventions, for coming home safe and well and having fewer postpartum complications, and needing to return less often to hospitals and medical centers to get care because in the postpartum time things have fallen apart. So in this time when I think we all need to examine how we can best support our communities, I think those of us that work in this field can best support our communities by skillfully doing what we do best. And so this course is designed to help us do that. So today and tomorrow, I believe, we're going to have an early enrollment registration option so that you can save some money while you get on board. I want to see as many of us being prepared as possible. Again, I was contemplating whether we just do this training for the people that work directly with the organization that I'm still a part of, or whether to offer it more broadly. And I hope that in our communities, we see that all of us are taking the same approach of being skillful and knowledgeable and evidence-based, and so I do hope that you'll join us and get on board. So March 16th is when we end our early enrollment, and at that point the online course will become available to you, and as such you'll be able to learn at your own pace and work through the lessons that will help you prepare for all that is ahead. And it's been an interesting ride already, and I hope that you are well and that your families are well, and we'll look forward to having these explorations starting on March 16th.